Hey guys, what's up guys? So this is another follow-up video of my going to dentist, like a dental surgeon, to get my wisdom teeth removed, extraction operation. So I went to dentist, not dentist, but a dental surgeon, specifically specialized on actual extraction or the aesthetic surgery on the teeth or stuff like that. So they're specific surgeon there focusing on some more complicated wisdom teeth extraction. I went there, got an appointment, and it was pretty easy. And then doctor spoke English, receptionist as well, and then I got list of extra operations, like optional operations with estimated price, with like insurance number side to side. So basically I'm gonna give you guys like a rundown of what I got told by a surgeon about what it's like to do wisdom teeth removal surgery in Germany. So basically he told me that, hey, so I took x-ray a year and a half ago last time, so he told me let's do it again. So I did x-ray, and then after that went back to the office. He checked the x-ray result and he said, blah blah blah, this is the kind of thing that I do on a daily basis, whatever. And x-ray is already covered by public health insurance that everybody pays if you're obtaining for private insurance, then private one. So x-ray covered, free, right? And then I told him, dentist or surgeon, that last time I went to a dentist like a year and a half ago in Canada, the dentist, she told me that the roots of wisdom teeth were a little too close to the nerve on the jaw. So she said she wasn't comfortable doing this operation, so she told me she's gonna refer me to a dental surgeon. And then that was what I talked about in the last video. And then as I said, it would cost me $2,500 total before insurance coverage. And then after insurance coverage, after basic public MSP in Canada, combined with extended health insurance that I had from company, total 90% covered out of $2,500, and I needed to pay around $400 out of my pocket. That was the last video that I covered. So this time he told me, you know what, blah blah blah, this is the kind of thing. And I told him about the complexity of the roots of the wisdom teeth situation. He said, oh yeah, that's true, like one teeth on the left here is kind of close to the nerve, so blah blah blah. But still give you some kind of summary of what he told me. Basically, even if it's a major restorative operation, categorized as major restorative operation in Canada, here, even if I get this done by a surgeon, it's all free. I don't need to pay for this full teeth removal thing. And then I asked him about, so like so this is you do everyday thing, right? And then you saw a lot of stuff, and also practice, residency, and read research papers, whatnot. So can you tell me from like statistical point of view how difficult this would be, and what is the risk of damaging a nerve? He told me, because he told me when I told him about like a nerve and then roots kind of get too close to the nerve thing, he told me, yeah, there's a risk of like nerve being damaged, but not necessarily nerve getting cutting in half. Not that severe damage, but maybe scratching the nerve or whatever. And he told me there's a risk of like lips being like numb for the rest of life kind of thing. That's a risk. He needs to tell that to patients. But again, he said if there's like a lower, medium, high risk, this would be less than medium. It's kind of like a lower, medium risk kind of operation, he told me. And he does this kind of a lower, medium kind of risk operation on a day-to-day basis, blah blah blah. But he told me that we did an x-ray, but he's told me that 3D x-ray would be more helpful, because that will give him information about what directions the roots of my wisdom teeth is like rooted in the gum, so that he knows when he's like probably like sticking out or like doing an operation, he knows which direction angle that roots are pointing at, so that he knows that are more information about, so to move this in that way and to not to damage nerve or whatever. So he told me highly recommended 3D X-ray, but without 3D X-ray, he can do it, and just 3D X-ray is gonna give him, easier time doing it, because he doesn't need to spend as much time because he knows that information. So he asked, so I asked him how much would that be, and he told me 3D X-ray would be 163.2 euros. 163 euros. It's not covered by public health insurance, and I'm gonna go into details about my external insurance, because I already emailed this price list to external insurance company so that I know how much they're gonna cover, if any. So I'm waiting for that. I just emailed today, 1 hour ago, and he also told me about post-operation. So there's gonna be holes after the teeth are being extracted. There's gonna be hole, and blood's gonna fill up the holes, and it'll be the blood is gonna be solid. It's gonna be hardened there to cover up the wound. That's how thing heals. It heals. But if you want, he said he can fit up collagen kind of thing into holes to avoid infection, or better avoid infection, because it's not necessary to fit in collagen in the holes, he told me. So collagen fitting operation itself is 23.28 euros, so 23 euros and 28 cents. And stitching, if you do fill up holes with a collagen, stitching operation is going to cost 54.39 euros. And then collagen, the material itself, I need to pay for 9.52 euros. All right. And last thing was the anesthesia. So anesthesia to make this portion numb, so that I don't feel pain all the time during the operation. The point spot anesthesia is also free. It's covered by public health insurance. I don't need to pay extra. However, he told me if I want to do generic anesthesia, meaning that I'm gonna go unconscious, so it's gonna be much more stronger. So anesthesiast is gonna do that, and then I'm gonna be unconscious during an operation. I don't feel anything. I'm gonna lose consciousness, and then I need to pay 300. He told me 360 euros for the generic anesthesia, but I heard about it. It's more tasking to the body, and there's a risk associated with it, blah blah blah. But in general, he told me that priority for me, if I can get extra options, would be 3D X-ray, which is 163.2 euros. And then without doing a spot anesthesia or full body generic anesthesia is up to me. Usually you can do with just a spot and you don't feel pain, but he told me I'm gonna feel the pressure and also cracking sound and whatnot, which I have experienced a little bit in the previous dentist. So that's all I got from information. So I emailed these documents to my external insurance company, and they're gonna get back to me next week about how much they're gonna cover. Definitely sounded like 3D X-ray is gonna help him do operation better and more safely, right? So I definitely want to do that. 163, if it's covered 100%, that'll be awesome. If it's like 80%, then still I might do, I don't know, 163, right? And I don't think I'm going to do collagen. And I'm going to give you information about what he told me about post-operation process. So he said operation itself is going to take about 1 hour, maximum hour and a half. If it's faster, then even less than 1 hour for 4 teeth, 1 hour. And then after that, first 2 days, it might be painful, it might bleed, whatnot. Some people optionally go get that prescription from him, a dentist or surgeon, and then go buy that painkiller from a pharmacy. And he told me that'll cost around 9 euros or 5 euros ish. I think it's 5 euros ish for 2 days. Painkiller, optional, 2 days, 5 euros, right? And he told me, so after operation, we're gonna book an appointment 2 days after. I'm gonna come see him and check up 2 days after. And after that, I'm gonna go see him again 1 week after. So 2 days after, and then 1 week after. 1 week after, he's gonna see that, and he's gonna remove stitches to cover up the wounds, right? So a week after removing the stitches, done. And then last appointment, third post-operation appointment is 2 weeks after. That's like the last appointment to check up everything is fine, you know, if wounds are recovering as expected or not, blah blah blah, and then all done. After 2 weeks or so, you know, you are pretty much recovered and you should be good to go, kind of thing. And then during the recovery phase, you know, first 2-3 days, you know, you cannot bite a lot of like, you know, hard stuff, so it's recommended to have like liquid food kind of thing. And yeah, depending on the people, they got their cheeks being swollen. It depends case by case, he told me. So that's that. And yeah, basically from a step, you know, next steps for me right now, I already emailed this you know, price list to insurance company. I will get answer from them, and I will decide if I'm gonna do 3D X-ray, you know. And after that, he told me, you know, make an appointment 2-3 weeks before I want to do operation. And I'm planning to do it in the mid-December, so I'm gonna call them probably in the end of November-ish or beginning of December. That's all. Alright guys, thank you guys for watching. If you have any more questions about this wisdom teeth removal extraction operation in Germany, feel free to ask me in a comment section. Basically, even if you get referred to a surgeon, all the operations gonna be free, covered under public health insurance, which is awesome because, you know, Canadian public health is only covered, you know, 80%. They have a quota how much, you know, they can cover. It's maximum like $2,000 ish. So I need to pay $400 Canadian out of pocket. But because I came here and I'm gonna do that here, I'm saving that money. But you might be saying, I might not be saving money because I'm paying a lot more for you know, those social welfare, health insurance and whatnot out of my pocket for every month from my paycheck. That's true, because this is technically not free because I'm contributing to health medical insurance and whatnot out of my paycheck every month. However, when it comes to, you know, if I'm paying out of pocket, you know, it's all covered by health insurance, so that feels better, obviously. And you know, if I have extended insurance, why not use that? Because I'm definitely eligible. I'm contributing to that every month. So that's it guys. Next, I'm gonna make a video, step 3, after insurance company get back to me about you know, what's the coverage of those extra optional thing. And then after that, I'm gonna make appointment in December and then do operation, and I'm gonna go through the pain and I'm gonna look like Alright guys, thank you guys for watching. I'll see you guys next time. Bye bye.